Hello guys, good afternoon. I welcome you all on Unacademy, India's largest learning platform. First of all, a little bit of introduction. Myself, Dr. Nidhi, I'm your physiology educator at Unacademy. This is my page on Unacademy, that is unacademy.com/@KGMC. Follow me out there so that you'll get link of every classes out here. This is the page, this is the code Dr. Nidhi. If anybody wants to join any paid course, you can use this to get additional 10% off. I have taken many plus classes, many special classes, so anytime you can join and revise your topic. Now coming to the subscription, we have plus subscription. What all are the benefit? You will be able to access both the live and recorded session. By chance you miss any session, you can see the recorded version. You have an opportunity to learn from India's top educator for the medical examination. We conduct this live test and live quizzes. From that you can analyze your preparation at any point of time. You have a flexibility. You can study on the device of your choice. You always carry your phone with yourself, so you can access your classes from your phone only. We have a question bank which consists of 25,000 plus questions. These questions are high yield question, clinical based question, and this is with explanation. So this is going to be very beneficial for all of you. Next is the iconic subscription, where you get access of India's two best platforms, that is our Unacademy and the Prep Ladder. So you are going to get all the plus benefit. Like I said, live classes, recorded classes, and live tests, live quizzes, and the PDF. Along with that, you get access for this Prep Ladder. In this, you can access the clinical and integrated essential of Prep Ladder, video lecture from the Dream Team, Question Bank 3.0, rapid revision and snapshot, and you will also be provided with the treasure and dream notes. So if you're looking for subscription that includes both, you can go for this iconic subscription. Next, special class feature. If you are talking about this one, a special class is way more special from the YouTube session because they are always and always live. Live interactive sessions are there, polls feature are there. From that, class is very engaging. Raise a hand feature is there. Now you can talk to educator in the live session, and if you follow any educator, you will get notification of their classes. After the lecture, you can download the PDF and revise it anytime, anywhere. We are started with this batch, that is Target NEET PG 23 batch, that is of 9-month duration. It consists of two modules, module 1 and module 2. In module 1, we are going to have subject-wise detailed study about the topic, and in module 2, we are going to revise those one. And for the repeater, we also started the batch, that is NEET PG 23 test and discussion batch, and its total duration is 6 months. So as per your requirement, you can take your subscription and start your preparation right now. Important announcement, iconic price is going to be very soon increase. So if you are looking for the iconic subscription that is going to benefit you both for the Unacademy as well as Prep Ladder, you should enroll yourself right now by using the code Dr. Nidhi. By using this code, you will get additional 10% off, and you will also save the penny by which you can go for another books, or you can purchase anything. So moving further, this is the fee structure for the plus subscription. This is the fee structure for the iconic subscription. This is the fee structure for the Unacademy Lite subscription. This is the fee structure for the MBBS First Prof subscription, and this is the fee structure for UPSC CMS subscription. So as per your requirement, you can take your subscription and start your preparation right now. So moving to our topic, today we are going to discuss some important curves in our respiratory system. The most important one is our lung compliance. So first, coming to this lung compliance, what do you mean by the compliance? During inspiration, what happened? There will be the stretching of alveoli. The alveoli will distend due to inspiration. So this stretching ability of our alveoli is known as compliance. Okay, so this compliance is opposed by two forces. First is the surface tension. This surface tension is exerted by the water molecule, and this surface tension is the first and important opposing force for the compliance. Next important factor which oppose our compliance is the elasticity of our alveoli, that is known as elastic recoil or elastance. So we can say that compliance is inversely proportional to surface tension. More the surface tension, lesser will be the compliance, and we can say compliance is inversely proportional to the alveolar elasticity. Okay, so next is our clinical disorder like is emphysema. In emphysema, what happened? The lung elasticity decreases, and we already discussed compliance is inversely proportional to the elasticity. So elasticity decreases means compliance in this situation is going to increase, and when compliance increase, there will be more stretching of alveoli. So there will be over distension of lung, and when we take the x-ray we will see the hyperinflation area. So this is important. Do remember, in emphysema we will get the hyperinflation areas in our x-ray. Okay, is this clear? This clinical aspect is very important. Do remember. Now next is the restrictive lung disorder like pulmonary fibrosis. So do remember, in constrictive lung disorder compliance increases, and in restrictive lung disorder compliance decreases. And when we are talking about the normal compliance, it is a 200 ml per centimeter of water. Okay, this is the normal compliance. And what do you mean by the compliance? For given change in a pressure, the volume change in our alveoli is the compliance. So we can say the compliance is equal to change in volume upon change in pressure. Or given change in pressure, the volume change in our lung is known as compliance. The normal compliance is 200 ml per centimeter of water. So see, this is the curve. On x-axis we take the transpulmonary pressure. On y-axis we take the lung volume. So this is a curve of compliance. So this is the normal compliance curve. And in this curve, which is in red color, we are seeing for given change in a pressure, the volume change is very, very high. So we can say out here the volume change is very high. So we can say this curve is of high compliance curve. Okay. And for this curve, this blue one, we are seeing for given change in a pressure, the volume change is very, very low. Okay. So this is a curve of low compliance. High compliance is seen in emphysema. So this curve will be of emphysema, and this curve is for pulmonary fibrosis, are restrictive lung disorders. Okay, is this clear, everybody? Now, same thing is written out here. In restrictive lung disorder, lung will not distend on increasing pressure. So compliance कैसे हो जाएगा? Compliance will become poor. So curve will come down. So moving further. This is the summary जो आपको याद रखना है. All the restrictive diseases as well as obstructive disease. First, coming to this obstructive disease. In this we have emphysema, chronic bronchitis, asthma, bronchitis, cystic fibrosis, aspirated foreign body, and the tumors. They all come into this category, that is obstructive lung disorder. In restrictive lung disorder, we have pulmonary edema, pneumothorax, pleural effusion, ankylosis spondylitis, kyphoscoliosis, polio, drug overdose, infant respiratory distress syndrome, asbestosis, and the silicosis. They all come into this restrictive lung disorder. So this classification is important. Do remember. Now coming to the different type of a compliance. First is the static compliance. This is during the breath holding situation. That's why it is known as static compliance, and its normal values we already discussed, that is 200 ml per centimeter of water. Now coming to the dynamic compliance. Dynamic compliance, as the name suggests, this compliance will change. So this compliance changes with the stages of breathing. What happened? At the start of inspiration, when we are talking, so at the start of inspiration, we all know our alveoli are smaller in size. So the surfactant is distributed in this smaller area. So the concentration of surfactant out here will be, do reply fast, everybody. Out here, the concentration of surfactant is more. So the surface tension is reduced. Okay? This surface tension is exerted by the water molecule, and this is reduced by the surfactant. Since concentration is more, so out here the surface tension is reduced more. And due to that, what happened? The overall surface tension is low, And we all know our compliance is inversely proportional to the surface tension. So out here, the compliance will be more. So at the start of inspiration, compliance is more, and at the end of inspiration, our compliance is less. So this is changing with the stages of breathing. So that's what is known as a dynamic compliance. Same thing is written out here. By the end of inspiration, क्या हो जाएगी? Our alveoli will become larger. And since larger alveoli में हमारा जो surfactant distribute होगा, वो larger area पे होगा. So concentration of surfactant outer is less. So surfactant कम होगा concentration का. Okay, surfactant concentration less होगा, तो इसकी वजह से क्या होगा? Surface tension will be lesser reduced. Is reduced less. So the overall surface tension out here is more, and we all know compliance is inversely proportional. So out here compliance will be more. So we are seeing that with the stages of breathing, our compliance is changing. This type of compliance is known as the dynamic compliance. Is this clear with everybody? Next is the specific compliance. So this is the derived one actually. When normal compliance is divided by the functional residual capacity, we get this specific compliance. Is this clear with everybody? If anybody has any doubt till now, you can ask. We have normal compliance, we have static compliance, we have dynamic compliance, and we have specific compliance. Now coming to the compliance curve. What we are seeing, this is the inspiration compliance curve. This is the expiration compliance curve. And what we all are seeing, the inspiration compliance curve is not coinciding with the compliance curve of expiration. And that lead to a gap between, which is known as hysteresis. Now coming to the point why the compliance curve is not coinciding, because the compliance change during inspiration is not coinciding with the compliance change during expiration. So that's why curve is not coinciding. So why it is not coinciding? Okay? Why the compliance change during expiration is not equal to the compliance change during expiration? What happened? At the start of inspiration, alveoli is small. So compliance क्या होगा? Compliance is small. ठीक है, at the end of inspiration alveoli are larger, so compliance is less. And when we are talking about expiration, at the start of expiration alveoli is large, so compliance is less. ठीक है, and at the end of expiration alveoli is small, so compliance is more. So during inspiration, compliance is changing from high to low, and and in expiration, the compliance is changing from low to high. So that's why it is not coinciding, and that's why it is leading a gap, which is known as hysteresis. Okay? Next important point, we can say this hysteresis because compliance change is not coinciding. Why the compliance change is not coinciding? Because concentration of surfactant is not coinciding. All these compliance change is due to this surfactant. So we can say this concentration of surfactant is responsible for this surfactant. Is this point clear with everybody? This is important. Do reply fast. Is this clear? Okay, then moving further. Now the steep portion of any compliance curve, what does it indicate? It indicates that for a small pressure change, the volume change is more. And इसको हम कह सकते हैं good compliance. So steep portion of our curve is indicating the good compliance. Next is the flat portion. What does this flat portion indicate? For given change in a pressure, there is no significant change in a volume. So we can say flat portion is indicating the poor compliance. Okay. So we can say highest compliance is at the end of expiration and lowest compliance is at the end of inspiration. So this hysteresis is due to surface tension, or you can say it is due to surfactant molecule. So when we wash our lung with the saline, this water will be replaced with this saline. So the surface tension that is exerted by the water molecule is not there out here. In this situation क्या होगा? Surface tension नहीं होगा, and surface tension नहीं होगा तो no hysteresis will be seen in saline washed lung. So that's why we get this curve. This is the air filled lung and this is saline filled lung. In this there is no hysteresis. Is this clear? तो saline filled lung में हमें hysteresis नहीं मिलेगा. Why is that so? Because this hysteresis is due to the surfactant and it is due to the surface tension which is exerted by the water molecule. In saline filled lung, there is no water molecule, there is no surfactant, so there will be no surface tension, and that's why there will be no hysteresis out here. Okay, is this clear with everybody? Moving further, now we have three compliance curve. First is the compliance of the chest wall, second is the compliance of lung, and next is the total compliance. See, this is the compliance of the chest wall. Okay, this is the compliance of the lung, and this is the total compliance. So this is the point where the compliance of chest wall is equal to the compliance of a lung. And this point is known as FRC or the midpoint or the balancing point. Because at this point, the compliance of chest wall is balanced by the compliance of lung. Because chest wall has a tendency to expand, lung has tendency to collapse, so these two are opposing forces. So compliance of chest wall and compliance of lung is balanced at this point, so that's why it is known as balancing point or the midpoint. Okay, is this clear? So this point is also important, do remember. So moving to the next, same thing is written out here. There are two opposing forces in thorax. Chest wall has tendency to move outward, while lung has tendency to collapse inward, and they are balanced each other at a point which is known as balancing point or the equilibrium point. And this coincides with our FRC. Okay, is this clear? Now coming to the next important loop of our respiratory system, that is the flow volume loop. So let me draw this one for all of you. On x-axis we take the volume, on y-axis we take the flow. Okay, first drawing this inspiratory loop. So this is our inspiratory loop. Okay, so this is our inspiratory loop, and this point out here is peak inspiratory flow rate. Okay, so this point is peak inspiratory flow rate. This peak inspiratory flow rate is 3 liters per second, and this is achieved after only 50% of inspiration. So after 50% of inspiration, our peak inspiratory flow rate is achieved. Hello, Dr. Aditya. Next is the expiratory loop. Let me draw this one also for all of you. This is our expiratory loop. Okay, so this point is peak expiratory flow rate. This is our peak expiratory flow rate, and the peak expiratory flow rate is 10 to 12 liters per second, and this is achieved only after 20% of expiration. Okay, so these all data are important, do remember everybody. So this is our peak inspiratory flow rate, which is 10 to 12 liters per second. So this expiratory loop consists of a two part. First is effort dependent. This initial part is effort dependent one. In this, what happened? There is more effort, there will be more flow rate. While this Next part is effort independent. In this part, we increase the effort, flow rate is not going to increase in this part. Okay, so we have two part, effort dependent part and effort independent part. So all these data are important because from these we can diagnose different type of lung disorders. So this point, from where we started the inspiration, this point, at this point the volume of lung will be, anybody? At this point the volume of lung is our residual volume. And at this point, the volume of lung is total lung capacity. So these all points are important. Do you remember? So peak inspiratory flow rate is 3 liter per second. Peak expiratory flow rate is 10 to 12 liter per second. Peak inspiratory flow rate is achieved at 50% of lung volume inspired. Peak expiratory flow rate is achieved at 20% of lung volume inspired. It consists of two parts, that is effort dependent part, effort independent part. First 20 part is effort dependent, next 80% part is effort independent. What do you mean by effort dependent? There will be more effort, there will be more flow rate in this segment. ठीक है, अगर ग्राफ दिया है, we can calculate the vital capacity, that is equal to total lung capacity minus residual volume. So this point corresponds to our residual volume, this point corresponds to our total lung capacity. So we can measure our vital capacity from the given flow volume loop. Is this clear? So do remember, this is a loop, not a plotted graph, because when we are moving in this direction on x-axis, volume is increasing, not decreasing. It is a loop, not a plotted graph. Is this clear with everybody? Do reply fast. Is this clear? If anybody has any doubt, you can ask. Do reply fast. Shall we move further? Excuse me. Okay, then moving further. Now coming to the different disorder and this loop. What happened in COPD? In COPD, what happened? This effort independent part is affected. We are seeing this scooped out appearance in this effort independent part, which is also known as the dog leg pattern. So in obstructive lung disorder like our COPD, we will get this scooped out appearance or dog leg pattern. So do remember, along with that, what we will see, there will be left shift of this flow volume loop. When left shift is there, our residual volume increases, our total lung capacity is going to increase. So do remember all these features. There will be scooped out appearance, total lung capacity increases, residual volume increases, loop shifted towards left, and there is a fall in this Tiffany index, that is FeV1 upon force vital capacity ratio decreases. Is this clear, everybody? And what happened to the compliance? Anyone? What happened to the compliance in obstructive lung disorder? In obstructive lung disorder, compliance is going to increase. So these all are the important points. Do remember, Tiffany index decreases, total lung capacity increases, residual volume increases, scooped out pattern or dog leg pattern will be seen in effort independent part. Next, in the restrictive lung disorder. In restrictive lung disorder, what we all are seeing, the curve shifted towards the right. The shape of this curve remains same, but the size of this curve is reduced, means our peak expiratory flow rate and peak inspiratory flow rate is reduced. ठीक है. Due to right shift, we can say our total lung capacity decreases, residual volume decreases. And what happened to the Stephani index? Stephani index either remain normal or increases in restrictive lung disorder. And what happened to the compliance? Anybody? What happened to the compliance? In restrictive lung disorder, compliance decreases. All these points are very, very important. Do remember. Coming to the diagram, this is the restrictive lung and this is the obstructive lung. So in obstructive lung, the causes are COPD, bronchitis, asthma. And in obstructive lung disorder, what we are seeing? We are seeing the hyper expanded lung because compliance is more. Okay? And in this, the loop, pressure volume loop, shift towards, do reply fast, shift towards the left. So what happened? This residual volume increases, our total lung capacity increases, and the Stephani index out here decreases. Okay, this is the restrictive lung disorder lung, and in this what happened? The reduced lung volume is there. So out here the compliance is less. And what happened to the PV loop? PV loop shift towards right. So since it shifted towards right, residual volume decreases, total lung capacity decreases, and the Stephani index either remain normal or increases. Is this clear, everybody? Example are pulmonary fibrosis, rheumatoid arthritis. So moving further, same thing is written out here. What do you mean by Stephani index? FPV1 is force expiratory volume in 1 second is approximately 80% of force vital capacity. ठीक है, 80% हमारा सिर्फ 1 सेकेंड में एक्सपायर्ड हो जाता है, and this ratio is known as Stephani index, and in normal situation it is 70 to 80%. And in obstructive lung disorder, the Stephani index decreases, while in restrictive lung disorder, the Stephani index increases or either remain normal. Okay, everybody, is this clear? Coming to the next, this PV loop is helpful in differentiating different type of obstruction. The obstruction can be either extrathoracic or intrathoracic. This extrathoracic obstruction can be either variable obstruction or it can be fixed obstruction. So this can be differentiated from this flow volume loop. How we can differentiate? See, in a variable extrathoracic obstruction, this inspiration is affected. So what we are seeing, the obstruction will be seen in this situation in the inspiratory phase. And for example, we have obstructive sleep apnea and paralyzed vocal cord. This is the type of variable extrathoracic obstruction, and this is going to affect the inspiratory phase. So only inspiratory loop will be affected out here. Okay. Hello, Dr. DM. Next is the variable intrathoracic obstruction. So intrathoracic obstruction, for example, a tracheal tumor, it is going to obstruct during expiratory phase. So expiratory loop will be affected out here. Okay. Now, last obstruction, that is the fixed obstruction. In fixed obstruction, क्या होगा हमारा both expiratory and inspiratory airflow will be affected. So both loop will be affected, and in this example are foreign bodies and the scarring of airway. They are a classical example of fixed obstruction, and in that what happened are both inspiratory and expiratory loop will be affected. So that's why this PV loop is important. From that we can differentiate different type of obstruction. From that we can differentiate either the diseases obstructive lung disorder or the restrictive lung disorder. Is this clear, everybody? Now coming to the next and the most important curve of our respiratory system, that is oxygen hemoglobin dissociation curve, OHDC curve. See, all the introduction point, first of all, it is sigmoid in shape. At partial pressure of 100 mm of Hg, the plateau phase is reached. Means at 100 mm of Hg, 100% oxygen saturation of hemoglobin occur. At 27 mm of Hg, 50% saturation occur. Okay? This is for the hemoglobin. And when we are talking about this myoglobin P50 is at 5 mm of Hg. Means the P50 of myoglobin is very, very less, and due to that, the shape of our OHDC, oxygen myoglobin dissociation curve, will be rectangular hyperbola, not the sigmoid. So let me draw this one for all of you. So on x-axis, we take the partial pressure of oxygen. On y-axis, we take the percentage hemoglobin saturation. Okay, so basically it is a sigmoid shaped. So this is the plateau phase. Plateau phase is reached when partial pressure of oxygen is at 100 mm. Okay, and this is the 50% saturation point, and this is achieved when partial pressure of oxygen is 27 mm. So this is the sigmoid OHDC. See, this is the curve, and 50% saturation is occurring at P50, which is known as partial pressure at which 50% saturation occurs is 27 mm of Hg, and plateau phase means 100% saturation occur at 100 mm of Hg. Is this clear? And for the myoglobin, the P50 is, this is the P50. For myoglobin, it is very less. It is approximately 4 mm of Hg. Coming to the next, the most important point out here is, we all know one molecule of hemoglobin combined with the 4 molecule of oxygen. In this, what happened? When first molecule of oxygen bind with the hemoglobin, it bind very tightly, and due to that, what happened? There is breakage of some salt bridges, and due to that, what happened? The rest 3 molecule can easily bind with this hemoglobin. This is known as theory of cooperativity. What do you mean by this theory of cooperativity? One molecule of oxygen bind tightly while rest 3 molecule bind with the ease. This is known as theory of cooperativity, and this theory of cooperativity is responsible for the sigmoid shape of OHDC. Okay, is this clear? Everybody? Moving further, now coming to the next important point, the shifting of this OHDC curve. The OHDC curve can either shift towards the right or the left. The right shift of OHDC curve is also known as the Bose Effect. So let me draw this one for all of you. So this is our normal OHDC curve. Okay, now drawing the right shift of OHDC. So in right shift, what happened? What happened to this P50? This is the P50 of our normal OHDC, and now the P50 of a right shift of OHDC. So what we all are seeing, that P50 in this situation is, reply fast everybody, the P50 out here is partial pressure of oxygen at which 50% saturation occurs. In the right shift, it increases. Means at higher pressure, 50% saturation is occurring. Means affinity of hemoglobin is, since higher pressure पे हमारा saturation हो रहा है, so we can say affinity is the decrease. So when affinity is decreased, there will be release of oxygen. Obviously there will be unloading of oxygen, and we all know this unloading occur at the level of the tissue. Is this 4-point clear with everybody? With the right shift, what we all are seeing, that P50 is increasing, means affinity of hemoglobin is decreased. Since affinity is decreased, there will be release of oxygen, and this release of oxygen occur at the level of tissue. Is this clear? All the 4 points? Yeah, very true. Coming to the causes, what all are the causes that causes this right shift? Hypoxia, hypercarbia. When hypercarbia is there, they are going to form carbonic acid. So in acidosis situation also there is a right shift. And when hypoxia is there, हमारा glycolysis कैसा होगा? Anaerobic, and that is going to form this 2,3-diphosphoglycerate. So this 2,3-diphosphoglycerate is also responsible for right shift of OHDC. High altitude पे क्या है? Prolonged hypoxia is there. It is also going to cause a right shift. During exercise, there is a demand of more oxygen to the tissue. So that's why the right shift of OHDC occur. Hypothermia, same thing. To deliver more oxygen to the tissue, it causes a right shift of OHDC. Next is the left shift. The left shift is also known as Halden's effect. So let me draw this one for all of you first of all. So first drawing the normal sigmoid OHDC. This is the normal OHDC. Okay, now drawing the left shift of OHDC curve. So what we all are seeing out here, this is the P50 for normal curve. And this is the P50 of left shift curve. So what we all are seeing, the P50 out here is, do reply fast. P50 out here is, do reply fast everybody. The P50 out here is, in left shift the P50 decreases, means at a lower pressure of oxygen हमारा 50% saturation हो रहा है. Yeah, very true. It decreases. No, Dr. Kishore, it decreases. We are seeing it decreases. Means at lower pressure 50% saturation is occurring. Means affinity of hemoglobin is, do reply fast, affinity is, lower pressure पे 50% saturation हो रहा है, means affinity is increase. And affinity कब increase होगा? Affinity increase होगा तो क्या होगा? There will be more and more binding of oxygen, or you can say there will be loading of oxygen. And this loading of oxygen occur at the level of, they occur at the level of lung. So all these 4 points are very, very important. Is this clear? Do reply fast. Is this clear? Now coming to the causes of this left shift of OHDC. Hypocarbia, alkalosis, fetal hemoglobin. This point is important to remember. Fetal hemoglobin में हमारा left shift of OHDC का होता है. Why is it so? Because affinity of fetal hemoglobin towards oxygen is more, and its affinity toward this 2,3-diphosphoglycerate is less. Okay, next, stored blood. In a stored blood, what happened? The glycolysis will be inhibited, and when glycolysis is inhibited, 2,3-diphosphoglycerate will be low, and that is going to cause left shift of OHDC curve. Okay, hypothermia. Hypothermia is also going to cause the left shift of OHDC. Is this clear? So see, this is the summary. यहाँ पे हम summarize करेंगे. Right shift is also known as, anybody? The right shift is also known as, do reply fast so that you can also revise this. Bose effect. It is also known as the Bose effect. Left shift is known as, no, it's not advisable. Left shift is known as Halden effect. In right shift, what happened? P50 What happened to the P50? What happened to the affinity? P50 out here increases, affinity decreases, means there will be release of oxygen, and this release of oxygen occur at the level of, no, P50 doesn't decreases, P50 increases out here. You can see out here the P50. This is the P50, partial pressure at which 50% saturation. This is for the normal curve and this is for the right shift curve. So P50 out here is increased. So P50 increases, affinity increases, so there will be release of oxygen, and this release of oxygen occur at the level of tissue. Very true. And this is seen in hypoxia, hypercarbia, acidosis, 2,3-diphosphoglycerate, hypothermia. They all are going to cause right shift. High altitude हो गया, exercise हो गया, they all are going to cause right shift of OHDC. Now coming to the left shift. In left shift, the P50, what happened to the P50? Anybody? Do reply fast. What happened to the P50 in the left shift? P50 decreases, means lower partial pressure, 50% saturation is occurring, means our affinity is increased, and since affinity is increased, there will be loading of oxygen, and this loading of oxygen occur at the level of lung. So left shift occur at the level of lung, while right shift occur at the level of tissue. So this is the summary. Do remember, everybody. Let's move to some question related to OHDC. First question, see, which of the following statement is or are true about OHDC? Fetal hemoglobin, shift the curve toward left. Hypothermia, shift the curve towards left. Hypercarbia, shift the curve towards left. Left shift causes more release of oxygen. So everybody answer this question fast. Which of the following statement are true? Take your time and do answer, everybody. Which of the following statements are true about OHDC? Question is asking which of the statements are true, not false. Fetal hemoglobin has higher affinity, so the curve shift towards left. Hypothermia, shift the curve towards left. Hypercarbia, shift the curve towards right to deliver more and more oxygen. Left shift causes loading of oxygen. Do remember, left stand for L, L stand for loading, stand for L. Left shift stand for L, and in this loading of oxygen occur. This occur at the level of lung. So all are standing from L. Is this clear? So answer is A and B are true. Everybody, is this clear? Coming to the next one. Oxygen delivery to the tissue is decreased by decreased hemoglobin level, decreased partial pressure of oxygen, increased partial pressure of carbon dioxide, increased bicarbonate, increased pH. Everybody answer this question fast. Oxygen delivery to the tissue is decreased by. Do reply fast, everybody. Yeah, obviously hemoglobin decrease होगा, oxygen delivery decrease होगा. Partial pressure of oxygen decrease होगा तो हमारा OHDC किधर shift करते हैं? OHDC shift towards right, and right shift में oxygen delivery होता है, तो it is going to increase. So this is wrong. Same thing, partial pressure of carbon dioxide increase होगा, OH/DC right shift करेगा, delivery to the tissue is going to increase. Same with this bicarbonate increase होगा, right shift होगा हमारा, OH/DC कर्व राइट शिफ्ट होगा. और एल्कलोसिस सिचुएशन, पीएच इंक्रीज हो रहा है, एल्कलोसिस सिचुएशन में हमारा OH/DC कर्व कहाँ शिफ्ट होता है, इट शिफ्ट टुवर्ड्स लेफ्ट, एंड लेफ्ट शिफ्ट में ऑक्सीजन डिलीवरी टू द टिश्यू डिक्रीजेस बिकॉज ऑक्सीजन की लोडिंग होती है. सो आंसर इज ए एंड ई. या वे टू डॉक्टर पीटरसन. Everybody, is this clear? Coming to the next question. Fetal hemoglobin has a higher affinity for oxygen due to decreased 2,3 diphosphoglycerate concentration, reduced pH, increased release of a carbon dioxide, OH/DC is shifted towards the right. Everybody answer this question fast. Fetal hemoglobin has a higher affinity for oxygen. Answer this question fast, everybody. Because fetal hemoglobin has a lower affinity to the 2,3 diphosphoglycerate. Okay, coming to the next one. An increase in which of the following parameter will shift our curve towards the left? Increased temperature, increased partial pressure of a carbon dioxide, increased 2,3 diphosphoglycerate, increased oxygen affinity of hemoglobin. Increase in which of the following parameter will shift our OH/DC towards left? Yeah, wait, it's a D. Increase in oxygen affinity occur when P50 decreases and P50 decreases in left shift. Answer is a D. Very true. Coming to the next one. Oxygen affinity is increased by all of the following except alkalosis, hypoxia, increased fetal hemoglobin, hypothermia. Oxygen affinity is increased by all of the following except Everybody answer this question fast. Oxygen affinity is increased by the following except oxygen affinity increases in left shift. Alkalosis causes this left shift. Okay, fetal hemoglobin causes left shift. Hypothermia causes left shift. Hypoxia causes a right shift. And in right shift, affinity is going to decrease. Remember? So answer is B. No, it's not A. Alkalosis, left shift होता है. Acidosis causes right shift. Coming to the next one. Factor responsible for left shift of OH/DC is increase in 2,3 diphosphoglycerate, fall in temperature, fall in pH, increased level of carbon dioxide in blood. Everybody answer this question fast. Factor responsible for left shift of OH/DC is Yeah, very true. Fall in temperature is going to cause a left shift. Fall in pH means acidosis causes the right shift. 2,3-diphosphoglycerate causes right shift. Increased carbon dioxide level is going to cause a right shift. So answer is only and only B. Coming to the next one. Which of the following factor influence hemoglobin dissociation curve except chloride ion concentration, carbon dioxide tension, temperature, 2,3-diphosphoglycerate? This is the easy one, I guess. All of the following factor influence OHDC except. Yeah, very true. Chloride ion concentration is not going to affect our OHDC. Coming to the next one. OHDC shift towards the right in all except hypercapnia, rise in temperature, increase to 3-diphosphoglycerate, or the metabolic alkalosis. OHDC curve shift towards the right in all except. Everybody answer this question fast. Yeah, very true. Alkalosis situation is going to cause a left shift, not the right shift. Coming to the next one. True about OHDC is acidosis shift the curve toward the right. Increased carbon dioxide is going to cause shift of the curve towards left. Hypoxia shift the curve towards left. 2,3-diphosphoglycerate has no effect on the curve. Which of the following statement is true for OHDC? No, it's not A. Acidosis shift the curve toward right. Yeah, it's very true. Sorry, very true. Acidosis shift the curve towards right. This is true. Carbon dioxide is going to cause shift towards right. Hypoxia is going to cause shift towards right. 2,3-diphosphoglycerate has an effect on our curve. So answer is B. Very true. Coming to the next one. OHDC curve shift towards right in all except. Okay, diabetic ketoacidosis, blood transfusion, high altitude, or the anemia. OHDC curve shift towards the right in all except. Do reply fast. No, acidosis is going to cause shift in the curve towards right. Yeah, way to blood transfusion. What happened in blood transfusion? We are giving the stored blood, and in stored blood, what happened? The glycolysis is inhibited. Since glycolysis is inhibited, our formation of 2,3-diphosphoglycerate is not there. So it is going to cause this left shift and not the right shift. The answer is B. Way true. Coming to the next one, during exercise, increase in oxygen delivery to the muscle is because of all except OHDC shift towards left, increase stroke volume, increase extraction of oxygen from the blood, increase blood flow to the muscles. During exercise, increase in oxygen delivery to the muscle is because of all except. Everybody answer this question fast. Yeah. OHDC curve shift towards right to deliver more oxygen to the exercising muscle, not to the left. So answer is A. Very true. Coming to the next one. In hypoventilation, what happened to the P50 and hemoglobin affinity? P50 and hemoglobin affinity decreases. P50 and hemoglobin affinity increases, decreases. P50 increases, affinity decreases. P50 decreases, affinity increases, and no change. This is a nice question, so everybody answer this question very carefully. In hypoventilation, what happened? Everybody answer this question fast. Yeah, very true. It's a D. What happened? Due to hyperventilation, there will be more oxygen in our lung. Oxygen is going to increase. Carbon dioxide washout is going to increase. So we can say carbon dioxide, partial pressure of carbon dioxide is going to decrease. And when PCO2 decreases, our curve shift towards the left. And in left shift, what happened? The P50 decreases and affinity P50 decreases and affinity increases. So answer is D. Is this clear with everybody? Due to hypoventilation क्या होगा? ऑक्सीजन इंक्रीज होगा, कार्बन डाइऑक्साइड डिक्रीज होगा. कार्बन डाइऑक्साइड डिक्रीज होगा, OHDC curve shift towards the left, and in left shift P50 decreases, affinity increases. Is this clear, everyone? Do reply fast. Shall we move further? Okay, then moving to the next question. OHDC curve is sigmoid. Why? Because binding of one oxygen molecule increases the affinity of binding of other oxygen molecule. Binding of one oxygen molecule decreases the affinity of binding of other oxygen molecule. Oxygen affinity of hemoglobin decreases when pH of blood falls. Binding of oxygen to hemoglobin reduces the affinity of hemoglobin for the carbon dioxide. OHDC curve is sigmoid. Why? Yeah, very true. It is because of theory of cooperativity. And what does it state? That the state that binding of one oxygen molecule increase the affinity of other oxygen molecule. Means rest 3 oxygen molecule bind with ease. And that is responsible for sigmoid shape of OHDC. Is this clear? Coming to the next one. Which of the following doesn't occur as the blood passes through systemic capillary? Increased protein content is there. Shift of OHDC towards left. Increased hematocrit is there. Decreased pH. Which of the following doesn't occur as blood passes through systemic capillary? Everybody answer this question fast. No, answer is not D. pH will decrease because when our blood passes through systemic capillary, it is going to take carbon dioxide from the tissue, and this carbon dioxide is going to form a carbonic acid. This carbonic acid is going to cause decrease in pH due to chloride shift. Chloride ion move Hamburger phenomena आपने पढ़ा होगा. क्लोराइड शिफ्ट की वजह से हमारा क्या होता है, जैसे सिस्टमिक कैपिलरीज में हमारा ब्लड जाएगा, कार्बन डाइऑक्साइड का ट्रांसपोर्ट होगा, उसमें क्लोराइड शिफ्ट होगी, एंड दैट क्लोराइड इज गोइंग टू ब्रिंग अ वाटर मॉलिक्यूल इनसाइड द आरबीसी. सो हेमाटोक्रिट इज गोइंग टू इंक्रीज. Shift of OHDC curve towards the right occur, not the left. When a blood reaches to the tissue, right shift occur to deliver more and more oxygen to our exercising muscle. Our tissues. Tissue level पे right shift होता है. Do remember, it is not the left shift. It is going to have a right shift. Is this clear? Everybody, is this clear? Shall we move to the next one? Okay, then next question of today's session. The normal value of P50 on the OHDC curve in an adult is 1.8 kilopascal, 2.7 kilopascal, 3.6 kilopascal, or 4.5 kilopascal. Now, everybody answer this question. Don't be in hurry. Read the question carefully, then only answer. Yeah, its answer is C. P50 is a 27 mm of Hg, not a 2.7 kilopascal. Okay? Do remember, when we convert it into kilopascal, answer will be 3.6 kilopascal. Is this clear with everyone? Do reply fast. Is this clear? Okay, then this was the last question of today's session. Hope you all like the session. If anybody has any doubt regarding the today's session, you can ask in the session only. If anybody has any doubt, you can ask, because we are about to end the class. If anybody has any doubt, you can ask. Hope you all like the session. If you like the session, do like and share. Most welcome, everybody. No, we cannot do the transfusion first one day before the surgery. Okay, we cannot do that. If you like the session, you should like and share the session so that many more can join and class will be more interactive in this case. And subscribe our channel, that is Unacademy Live NEET PG. And don't forget to press the bell icon so that you will get notification of any classes on this page. So do press the bell icon so that you will get notification of upcoming classes. So regular मेहनत करते रहिए, you will definitely able to achieve your target. You will definitely able to crack your exam with good rank. Do more and more MCQ. I will guarantee you, you can get your success very easily, because doing more and more MCQ, you will clear your all the conceptual knowledge. So yeah, very true. In restrictive lung disorder, compliance decreases, while in our obstructive lung disorder, our compliance increases. So let's crack it together, everybody. This is the code Dr. Nidhi. If anybody wants to join any paid course, you can use this referral code to get additional 10% off. That's all for today's session. Hope you all like the session. See you all in the next session. Bye-bye, everyone. Yeah, we discussed this flow volume curve also. I think you joined late. You can go and revise once it is uploaded. Is this clear, Dr. Goswami? You all should follow me on Unacademy also. My page on Unacademy is unacademy.com/@kgmc. Follow me out there so that you can join many more classes. You can get this link in the description box only. So go there and do follow me out there. Okay, then bye bye everybody. Signing off this session.